My name is Trina Coy. I'm a mother of 3 beautiful children and a wife. We've been together 11 years. And I was recently diagnosed with first stage 3A breast cancer, which has progressed to stage 4 through my care at Kaiser. I grew up in the city of Rodeo, California. We lived off of California Street, which was about a block away from Hillcrest Elementary, and it was leveled due to toxic exposure. Kids were getting ill. I actually just recently found out about it. I just know growing up there, I would look out at night and there was a flame, and you'd watch the flame burning, and I never really questioned it until I was looking on the internet trying to understand my disease, and people were talking about how you grew up near a flame, and I would watch it at night because it was beautiful. I didn't realize that we had 3 different refineries around us and what we could be exposed to. I spent most of my 3rd and 4th grade year very, very ill. No one could figure it out. They'd send me home. They they thought maybe it was my cleaning agent on the desk. It wouldn't get better. So I missed most of those years. But when I was moved from that school, I seemed to do better. I had horrible allergies. Remember, there are certain days that we would be told to go inside the house and shut the windows and not open them. We had one cloud that was on the news, a big black cloud that went over. We weren't asked to evacuate. We were just told to go inside and close our doors and windows. But being a kid, I didn't question that. I just did whatever, they said. I lived there from the time I was about 4 until 17. We moved to Concord. And when I was 26, I was diagnosed with cervical cancer, stage 4. And my doctor was blown away because it was a rare aggressiveness for someone my age. It went from 0 to stage 4 in under a year. You have to go for your yearly, and they make you get in right before the year. So it was about under a year. And I had a full cone biopsy. Went on to have 2 children, so I thought everything was fine. At that time, I kind of wondered about Rodeo, only because my mother at that time was diagnosed with CML leukemia as well. So little after that, both of our dogs died of cancer who were in Rodeo with us. And we have no family, at least on my mother's side, we have no family history of cancer.
So this is pretty weird, all these...
It is amazing. Now that I have the breast cancer, I'm researching, trying to understand my diagnosis. And with the Facebook, you start reconnecting with people from high school. And everyone has cancer, or they have some strange autoimmune diseases. Some can't get pregnant, and it's everywhere. And we've already had a classmate die before our 10-year from cancer. And so I know people get cancer, but everyone I talk to from my town, it's like an epidemic. It's amazing. I've had to dig and dig, and I've found that it was one of, and which most people don't do because you don't realize that you've been exposed. But after you've had 2 cancers, you start trying to protect yourself, trying to understand, because I'm an avid exerciser. I watch my diet, I eat to my digestive system, work out 5 days a week, leg press 540 pounds. So it's not a dieting issue. So I just was like, well, there's got to be a cause. And when you don't have a familial cause, you start looking, what else could be the cause. And I just can't, with all the information I come across, I know it has to do with Rodeo because they're one of the top cities of leaks. They leveled my school. I realized that years after the fact. They actually tore it down. It just sits there empty. And that was because there were a lot of lawsuits, I guess, in 1994, I think was what I found, which I was already gone, so I didn't know about it. And a lot of those people were exposed to benzene. I see a lot of exposures to mesothelioma. So it would be nice to know all of the things we're exposed to better combat what I have. And I don't think they realize it because you're just living. You're just playing. You're a kid. You're out playing, and you're not right next to the factory. And some people don't even realize. Like, I met a young man by chance a few weeks ago, and he happened to say he was from Rodeo, and he graduated, I think he said, in 2001, so he's already been diagnosed with MS. And he goes, I never thought about it being from the refineries. But when you go on there and everyone's dying of cancer, and they're usually rare aggressive forms. We have another person that we know there with a rare form of blood cancer that they don't really know anything about. And, so when you have person after person that you grew up with and knew, you start wondering, there's got to be a connection. And the only connection we have is the area. There are three. They did actually level one of them near the Garrettson School. Again, I haven't been in the area. I think Garrettson is still in existence. I think they actually had to move the people from the Hillcrest Elementary there. And they're building homes on top of the refinery area. Very beautiful homes. I went to a friend's birthday party, and this is the area that the refinery was located. People are now living on top of it. So I don't know what the ramifications will be, but I personally wouldn't move there. I mean, I'm pretty healthy, and this is my second cancer. I was with the John Muir Health Network for probably 18 plus years. Never had one problem, not one incidence. Had great care, wonderful doctors. And my husband's union decided to drop that policy because of all the economic issues going on. And we were given two choices, one with an extremely high deductible and a family of 5 on a tight budget, because we felt it was best to be home for my kids so that they could grow. And we assumed I'd be going back to work before the
What did you do?
I did human resources. I was in a management position with Albertsons. And I saw my son 1 hour a day from commuting from Antioch to San Leandro. So we decided that I would stay home and go back later as the kids both got into school. We hadn't had my daughter yet, but we knew we'd had one more. And when this change came, I look at the two plans, and economically, we just couldn't do the other one with all the deductibles and the out-of-pocket expenses. So we went with Kaiser. And right out the gate, I knew there were problems. My son he had some hospitalization issues, and in John Muir they had a tremendous amount of care. Kaiser didn't offer it, and so.
What kind of care did they have that Kaiser doesn't have?
Oh, they had inpatient 5 days a week, people on staff, and when I went to Kaiser, they had no such program in place. And they pushed him out of that. They actually covered it for a while because he was already in there. And they pushed and got him out of there sooner. And when I got there, they had an intensive program. And what I didn't realize was they gave me a counselor for him once a month. And it was a postdoc. It wasn't even a full-fledged doctor. Now, this is an intensive case, not, just a regular couple dispute or something like that. I was getting that when he had no problems at John Muir. I could get in at least monthly, if not weekly. They couldn't even do that for me. And when I complained because his therapist was just playing Yu-Gi-Oh with him and not working on issues, I said, no, I know part of the thing is to play and discuss. They told me I have one person running the whole department. Her name was Beach, I believe. And I spoke with her. I said, you're it. I'm it. I have some postdocs. So there was no care for him, which puts him at danger because he just stepped out of an intensive program. I was really shocked at that. So we just worked through the system. I worked through the school district, and we stabilized him that way. And then I went in 2008. I had my daughter. She was, I'm guessing, about 8 months. It was April. She was born in June. And I had a mass knot. And I'm young enough where you're not worried about self-exams. They don't tell you yet because you haven't hit 40. But it was a huge, huge knot, so you couldn't miss it. It was a knot, and when you pushed on it, it was very tender. So it didn't cause me pain just sitting there, but if I touched it, felt bruised inside or something. So I went in. I was having other issues when I came into Kaiser as well. I have the cervical cancer in the past. They saw some more dysplasia, I think is the word they use. So I immediately went in there with issues. And I always explain my toxic exposure and my rare form of aggressive cancer, because if you look at me, you assume you're dealing with an average patient. She's healthy, she's young. I didn't want to make sure that they realize what kind of patient they had. And they did some testing, and the first thing they gave me was an HPV test and told me that I did not need a pap smear for 3 years. And that didn't seem right to me because in under a year I went to stage 4, so why would I want to allow 3 years to go without testing? If I could go to stage 4, and at the time they actually thought it might have spread to my uterus, which would have meant a hysterectomy at 26. I feel blessed that that didn't happen and I was able to have my children. So I asked them, and they said, no, the HPV test, if you don't have the virus, you're good for 3 years, because it didn't seem right. So I said, okay, I was worried about the knot. I was given a pamphlet of instructions talking about how to nurse more often, put a heating pad on it, things to relieve it and hopefully clear it. And I asked her, I don't have a heating pad, would it be okay? And she goes, oh, you can put take a warm shower, the nursery daughter. So I did all those things. And on the pamphlet, the only time to return under an emergency, there was no, I need to see you in 4 to 6 weeks. It was just, here's your pamphlet. So I looked at that, and it said if I had redness in the area or if I had very high fever. I never had either one, but it still wasn't going away. And I was having bleeding issues as well, which was concerning based on the history. So I went in for that. And that visit, I believe that either I questioned it or she observed it, because you couldn't miss it. It's very large, and it's in my medical record that it's a clogged duct. I said, well, they told me it was a clogged duct. That was it. Nothing else was done. I've seen another doctor a couple times. I did ask at one point when I wasn't nursing, well, why do I still have this clogged duct if I'm not nursing? And twice I was told that it was just because I still have ducts in my system. You still have it's just not being active. Okay, so when you continually hear from doctor after doctor, I started to dismiss it because it didn't seem right. But when you hear the same answer, you think, okay, I'm just being paranoid, this is normal. And again, I don't have a history of it, so I just accepted that to be true. The first doctor that I saw, Dr. Joseph, she wasn't a doctor, she was a nurse practitioner, and that's what I got with a aggressive form of cancer history. It was a nurse practitioner. I had an issue, and it was very concerning to me, so I described what was seen, and she looked right at me and she says, well, you can keep describing it, but I can't tell you what it was, which was really shocking to me, because I'm thinking, you're in the OBGYN field. I know you can't diagnose it because it's not here. However, you could give me some idea to relieve me that it's not abnormal, I'm not crazy. And when you go on the internet, you can find such things, and you're in the field. So I didn't like, her care with me. And I, at that point, said, I think I need someone with a little more experience given my history, and I requested. To this day, she is still on my panel, even though, as far as I knew at that time, I was moved to Dr. Lee. When she saw me, she examined the breast lump as well, told me again that it was a clogged duct and I could still have clogged ducts, and put a heating pad on it. Didn't seem concerned at all. We were working on the bleeding issue, to which they kept making me get on birth control pills despite many years of one particular brand. Kaiser didn't cover it, so they didn't want to pay for it. So the first time I was breaking out horribly, which isn't the worst thing in the world, but as a mother, I'm going in these places looking like a pizza, and I never broke out as a kid, and I just wasn't feeling right, very tired. So I told her, and she decided to try another one. Dr. Lee didn't like the one that Yasmin was the one doctor wanted me, and I came home and there were all kinds of warnings, and it was in a lawsuit. So I thought, why on earth would that be the one you prescribed me right now until that's resolved? But Dr. Lee prescribed Sprintec. After the fact, what I found out was that's the cheapest form of birth control pills, that they cover it at Walmart for like $8 over the counter. This pill made me horribly sick. One of the things I was told with the last one is I had to give it a fair chance to, actually sit in and get cycled in, so give it months to, regulate, which made sense to me. So I did that with the Sprintec. And over those periods, I got sicker and sicker. I was exhausted. I was moody. My eyes started blurring. My heart was having heart palpitations when I ran, shortness of breath. I had dark spots coming into my face, which when you're going through this, I thought first it was an age spot, and I got more. So it didn't happen overnight. I started getting strange bumps on my breast. But I guess now if you look into breast cancer, they call it puckering. So I emailed, and the thing that was really obvious was I was pouring on weight. I was exercising more, eating less, and just puffing out, looking pregnant. So I emailed her about that, and she told me I was just getting older, that it was an aging process and women go through this. And I said, but this isn't, I should exercise and diet more. And at this point, I'm frustrated because I had forgotten this piece. But when I first went in there, I had blood work done. I had a bruise about this size of my arm after one blood test. I'm very vascular. Nurses love me when they see my veins. And sitting next to me, my son had to have some blood work as well, so we went together, and they were stabbing him 7 or 8 times. Couldn't get the blood. Neither one of us have rolling veins, so we were shocked because of years of John Muir, not one issue. And I was actually concerned, so I took a photograph of it because it was the whole arm, black and blue. It looked like someone beat me up. And they tried to tell me it was because I didn't put a cotton ball in it long enough. Well, when I got my test results, it told me that I had, I think the word was kidney failure, kidney functioning issues, and high cholesterol. And I should diet and exercise for this. And we were laughing about this because of my regimen and my how I diet. So I read it to my mother-in-law, and I realized it said from my urine sample, but I never gave a urine sample. So I emailed my doctor immediately. He claims that there were typo errors. I didn't feel comfortable with that. I wanted a new test. Since then, none of my tests have been similar to what was done on that day. I mean, so I find it hard to believe it was just a typo error. And I also voiced my concerns about what had happened with the blood draw, that I was really terrified after that experience, because I wasn't sure what they had done internally to me. And he apologized for that experience and sent me back. Well, when I went back, there was a student, and they took my blood, all the paperwork. They labeled all of my bottles, got me prepped, got the thing around me, and then says, "Oh, do you mind? I'm a student." I was very uncomfortable after my last experience, yet there was no one in the building that she could readily access. She would have had to go outdoors to find this person. So I just let her do it, despite being afraid. And I thought to myself, if a student, why wasn't someone standing by her and supervising her? She was all by herself, because I went in the evening. I've since had that experience more than once, and I've asked Kaiser, the member services, I said, can't you at least label? I asked him, why don't you ask them outside so I don't have to look this person in the face and feel very uncomfortable in that? Well, it's fine for you and it's fine for her. I said, it's not fine for me. I feel very uncomfortable doing that, and I have to bring in paperwork. Well, that I can't communicate with the desk, but you can literally see the desk. So I didn't feel listened to, respected, because I'm paying for doctors, not students. And if I choose to have a student, then you can ask me that and respect my privacy rights. And I've made a couple complaints, so I'm hoping in the future that will change. But I went back and after that complaint, and the same thing happened. So I guess they're not going to address it.
So this use of students by Kaiser to save money, apparently, they don't want professionals. They would rather have students, but they don't even inform you as a Kaiser patient that a student is taking these tests?
No, and he handled all of my blood work and all of the labeling before asking me if it was okay, which if he did an error in the labeling because he's a student, and worst of all, the person wasn't standing right over him to make sure that the needle was going in, I guess, wherever, whatever it was, because I'm not a medical professional, to make sure that he was doing it properly. In retrospect, I kind of wonder if the guy who bruised my arm was a student and didn't identify himself. I have no way of knowing unless we went through the records and found out who took it. I would hope that a professional wouldn't do that bad of a job in a blood draw.
So did you make any complaint, to the government, or is there oversight? That they're doing these medical procedures, it is a medical, without professional people?
Well, at the time, it's very new to me. John Muir, I never had that experience. Everything was very professional. I've never encountered a student. So I just tried to discuss with my doctor my concerns. I thought I was a rare case. I never dreamed that, I'd be sitting here today. And I don't like to complain too much. I try to just, get my care and move about my life. But it was, and in fact, I hadn't even complained about the bruising until I got wrong results. And at that point I said, look, I'm really afraid to go back now because this is what happened. I thought it was a fluke thing. I had no clue. Same with when I was with the doctors with the clogged duct. You think you're getting good care. You feel you're getting good care because you aren't a medical professional, and there's no way for me to understand that. I had to diagnose what was going on with the pill. As I was saying earlier, I got so sick from it, and I'm arguing, email back and forth, saying this is not normal, and she kept telling me I'm aging. And I got so frustrated with this because I knew that wasn't the case, and the thing with the blood test and her, they recommended diet and exercise. And in a sense, that's a malpractice as well, because if they had taken time to know me as a patient, they would realize that exercise was not a factor, and they could have been putting me in harm. If I did, in fact, have such high cholesterol, it was probably another reason, and they should have been finding out why, not sending me home with a diet and exercise program. I mean, had they at least asked me, do you work out? What is your diet like? Then they could have given me diet and exercise as basically a prescription to alleviate the high cholesterol or this pill issue and the weight gain. But that's not the case, and I had demanded that they add that to my file so they know who they're dealing with rather than do that, which to this day is not, because they're clueless. So I began researching on my own the Sprintec pill, and I'm actually shocked it's on the market, because I mean, all pills will have good and bad results for people, but this one just had mass amounts of bad results. People actually having outer body experiences. I was very angry and agitated, which isn't like me. It was just
changing your whole emotional.
I was a different person. It was changing my family dynamics, putting stress on us. And at that point, I told her, I've researched it, all of the symptoms. I would also have, and I reported this to her, if I would drink a half a glass of wine, I would go into burning night sweats and feel horribly sick the next day, which I'm not a huge drinker, but usually on the Saturday night I would have one glass of wine because of calories. We only, that's the reason I only had it once a week. But I always had a high tolerance for alcohol. So this was really weird that I would, go into these burning, felt like a huge fever in the middle of the night. I was having night sweats, to which this doctor would just look at me and go, well, I don't know. And in retrospect, I would say if anyone has a doctor tell them, I don't know, you demand they find out. Because I figured if it's not alarming to them and they don't know and they're not acting on it, I felt I was okay, which was not the case.
Now Kaiser represents a lot of people from the Rodeo area who have similar probably problems, symptoms as a result of living in that area, that environmentally toxic area. Have they ever put you in touch with a group or said we're going to research what's going on with the people in that whole area?
Not at all. And they won't even address the toxic exposure that I had. When I was given my chemo regimen, I was hesitant because of that predisposition. Also having a mother who has leukemia, and the side effects were leukemia. And I'm sitting there thinking, do I want to fight leukemia and breast cancer, or just try to battle the one disease? And I was told it's not standard of care. I can only have the TCH regimen or arithmetic. It's another similar one. And there was no working with me. I said, can I have Herceptin only? No. And so I sought a second opinion. And I had mentioned some holistic approaches, boosting my immune system because of my immune system being attacked by the exposure. And they put notes in there warning about me, because my mother is 11 and a half, oh gosh, I think she's 12 years now, a survivor of leukemia, and she did not do the chemo, and she did diet change and supplementation and a lot of other things. She's on Gleevec as well, so I'm not opposed to having mainstream medicine at all. But given my circumstance with a mother with leukemia, I was concerned about my immune system being able to handle it after all of that. And so I went to the second opinion, and who I was referred and told that she was willing to work with patients. Another person had a wonderful experience with her and how wonderful she was. And so I walked in, and she just had already discussed with my case, because she had mentioned the alternatives, which I hadn't discussed with her. So that led me to believe that she was discussing it with my previous oncologist, gave me lectures about that, told me every single doctor in Kaiser would give me the same exact regimen because it's standard of care. And at that point, I was in tears. I said, I wanted a second opinion. I have a very serious disease, and you are entitled to a second opinion. And I don't believe a second opinion is two doctors sit there and talk, and you tell them that you get the same recommendation. What they should have done is looked at what my diagnosis was, let her and I sit down and discuss it, and tell me what with that she came up with. That's a second opinion. You don't discuss with the previous doctor, And at that point, I gave up on getting any more second opinions, because she told me point blank that every doctor here will give you the same one because it's standard of care. So I was, I have done so much research. I've sat with breastcancer.org. I was on one of those sites in forums, and many other women were getting different treatments. And I asked for such treatments that had a lower toxicity, such as Nebuline, maybe the Taxol without the it's a C, T, C, and H, so just a T and H instead to reduce that. The other thing is we have a heart failure problem on my mother's side of the family, and I was having heart palpitations from the pill. Herceptin increases those. They know a specific chemotherapy agent is linked with that, so that was the other option for me. So I thought maybe by reducing it a little less chemo, that would reduce my risk of having heart failure because of this. So I wasn't opposed to doing nothing at that point, but they would not work with me in any way. And these are regimens that people on the breast cancer or boards were getting. So it is doable. I know someone that was getting Herceptin only who had a lower stage than me, and I was told it's only a 4 stage, but she's at Kaiser. So I said, if you can give it to a lower stage person, you can give it to a more progressive stage than mine. Why can't I have that? Because it directly is targeted to my cancer.
So, I mean, this practice of Kaiser of standardized care, of not allowing procedures that are available in other places, what's behind that?
My guess is to save a buck. And they saved a buck with me, by not sending me to a few tests, but now I'm sitting here fighting for my life. It would have been very simple to have had a mammogram. My very first mammogram was with breast cancer. I had never had one before. They could have monitored my clogged duct, and I found out later, once you're misdiagnosed, more things come up. And I was able to realize I could have had that duct drained. I was never offered that either. And that is standard of care. If the duct persists. At the time when I researched it and just said clogged duct, not nursing, not lactating, I tried every kind of combination I could, and nothing came up. You just got nursing sites and how to relieve the pain, so I thought I was okay. After I used the word misdiagnosed, I was able to pull up pieces. I think there needs to be more information out there just for women in general, so that you can be your own advocate if you are stuck in a place like this. They tell you breast cancer doesn't hurt. Mine hurt, and every woman I've talked to, the breast cancer hurts. So I think it gives a lot of false hope to people. I mean, I think you don't need to panic, but I don't think having that idea out there that it never hurts when you look at sites is fair to the women, because it makes you think you're okay, and you're not.
Now, I mean, in this medical system that we're in, if you have medical care, and a lot of people don't, should you be able to go to any doctor you want? And it seems like people who are locked into these HMOs are stuck and really can't get a second opinion, really can't get other things because they're stuck in this particular system.
I really think you should myself. I think the HMO design is harming people because when you have a doctor who is responsible for all of our patients and gets to know them, she can know who to listen to and how to listen to. And like my last OBGYN was phenomenal because I saw her all the time. And she knew who I was. She kept her own notes, so she wasn't trying to read someone else's notes, which is a huge difference because she was proactive because of that. When I go to Kaiser, all the different hands in the pot, there's just mistake after mistake. I'm one person in 3.5 years, and I had my mastectomy December 28th, which was supposed to be an overnight procedure. And because of all the chaos and so many people in the pots, and I think they're overworked. We have a friend who's a nurse and says, I don't have to do any of my paperwork at the John Muir system, but those who go over to Kaiser have it all thrown on their lap. So how do they care for their patients equally, like John Muir, when they have double the job? So I don't think it's necessarily sometimes the nurse's faults. I think that they're just given too much load that they can't handle. If they could handle it, all places would do it that way. But when the other care systems aren't having as many issues and they have the extra help to care for their patients. And I noticed that immediately in my surgery. When I went to John Muir, I was woken up constantly by tests and checking on me to see if everything was okay. So much so I was like, would you let me sleep? But when I went to Kaiser after my surgery, well, they left internal bleeding. And I had a woman check the internal bleeding. It was this side of my chest on the mastectomy swelled up. And it was purple, black and blue. And I'd never had one, so I called her in. And always, this woman seemed very agitated when I asked her for help because no one ever came in and checked on me. I had to call in order to be seen, which was very different than John Muir. And I'm a patient that would rather just wait until they make their rounds rather than to bug them every 2 seconds for water. I just kind of wait up for all my needs and then ask them at once. But that wasn't happening here, so I realized I had to call. And she looked at it and she says, I don't know. And my husband was sitting right there, and because I was voicing my concerns to him, and she left. So I figured it must not be anything if she just dismissed it. Well, I was woken up by one of what I considered a good nurse there. She was looking at me asleep, and I had internal bleeding. And they had to pull a surgeon out of the OR to come check it because they were so short-staffed. And she came out and goes, oh, no, this isn't good. Oh, no, I may have to call my surgeon back in. And she rushed off, because she's got a surgery. And I sat there and I don't know, hemorrhages, I was convulsing, which scared the heck out of me. I had internal bleeding. I didn't know how long I could bleed for. And they were covering me with blankets. I begged them to call my husband. And the poor nurse just looked at me, and I said, how long, is she going to be quick? What's going to happen? Can I sit here this late? And she just kept telling me, well, she should be fast. She should be quick. She's doing an appendectomy. I sat there for an hour and a half bleeding because I had no surgeon. And
what hospital was this at?
I was at the Walnut Creek Kaiser. And that's the other thing is these are different facilities. That's why I've lost faith in the system. Because if I was just at one facility with one doctor, that would be different than going from 3 different facilities, different doctors. And I was rushed in for a second surgery. I also had to beg for food. They didn't have a bed for me, even though it was a scheduled procedure. They put me back in the pre-op room, which they told me beforehand I'd be moved to my room. And so they didn't have food for me. And the nurse actually looked annoyed. It was like 7 or 8 o'clock at night. And I'm like, I had to fast the night before. I just had a surgery. You'd think you want to replenish my system so I can recover. And she goes, oh, well, most people don't want to have dinner after surgery. I said, well, you think you could? I do. You'd think they would have asked. She ended up getting me something to eat. And at that point, I demanded that the other woman be removed from my room. And I've never done anything like that in my life, but she was so agitated and looked at because I'd asked for a TV because I was sitting alone in a room and we didn't plan for my husband to be there because we thought it was overnight. We didn't think he could stay, but I guess he could have. So he had actually left. That's why he had to be called back in. And they were annoyed. I said, can I bring my laptop in? She goes, I don't think you can have your laptop because my arm not supposed to be moved after the mastectomy. And she wheeled in an old TV that buzzed on the stick, the old-fashioned kind. But she was annoyed about it. And I'm like, but you guys didn't give me a room. I wanted something just to take my mind off the situation. And most rooms do have a television. And I fall asleep to it. And she goes, is this fine? It's buzzing and it had lines through it. I said, I can't watch that. So I asked my husband to have his sister bring me some videos. We brought a laptop in. So I had to bring my own stuff and have a laptop on my lap just so I had someone with me. And she was very annoyed by that too. The next morning, I was moved to another pre-op room because they still didn't have a room for me. My blood pressure was dropping really low from the second surgery within 8 hours. So I had to walk down halls to get to a bathroom because I wasn't in a private room with low blood pressure. That lady walked me to and from. She was really, really helpful. She sat with me. Again, they didn't have food for me again, so finally they got me a breakfast. I was moved to a second room, which was finally that day. That's the second day I was in. In there, it was just more continued errors. They finally brought me food, but they gave me a liquid diet. And I asked the person, I said, I'm not on a liquid diet. Well, your name's Trina Coy, right? Yeah, it is, but I'm not on a liquid diet. I just ate a breakfast burrito for breakfast. And she's like, well, that's what they ordered for you. So then I had to ask the nurse, and this nurse was so busy, she couldn't remember anything. She couldn't remember my food. At one point, they finally brought me 2 meals because they kept forgetting. At that point, the blood pressure the draining was coming out way too rapidly, so they decided to give me 2 pints of blood. So I got my first one. I'm guessing it was about noon around the lunchtime. And my mother-in-law was with me that day, and she had just walked by dog feces, so she was upset about that in the hallways, which quite understand why dogs were in there. But the woman next to me, I believe, had a stroke, and she had some buzzer going off forever. And my mother-in-law finally got up and asked her if she was okay because no one was coming to see her. And a little while later, I want to say it buzzed for like 40 minutes at least. It was driving me crazy. And the person's daughter came in to see her, and she actually had to walk, because my mother-in-law looked down halls, but she says, I can't see anyone, and she was still with me. So that lady found someone for her. They kept forgetting my second blood transfusion. This here, they did not walk me to and from the bathroom. They would help me out of bed, and then I was on my own with low blood pressure, which was not usual. And
so it sounds like there's serious staffing issues that threaten the health of the patients if they don't have enough staff to take care of people in a serious situation.
Oh, definitely. It took me 8 hours after multiple requests to get my second blood transfusion. By the second room, I was told I was supposed to have a pee hat, which I asked this lady, what is a pee hat? Now, I'd been 2 days, and you would think the most critical time is right after surgery. Apparently, they need to monitor your fluids going in and out through your urine. I'd never been monitored at all, and I didn't even know about it. I finally got the second blood transfusion. I had to ask her. I said, do I physically need it anymore? It's been 9 hours, 8, 9 hours. Can you check with my doctor? And she seemed annoyed. I said, but I don't want to have an unnecessary blood transfusion, and my blood is now going up because it's been so many hours. And they decided to administer it anyways. And again, I think this is all happening because these women are just overworked. If you talk to another nurse and they have someone doing all the paperwork, and this person has paperwork and care, how do they have time to care for their patient if they're so busy doing the paperwork? And why wouldn't all systems be doing the same thing? Why are they the unique one? And then yet they have more errors. I contacted one lawyer, and he said 70 to 80% of his cases are against Kaiser. And I'm like, that's unacceptable. I'm calling cancer center after cancer center with, trying to get help and trying to figure out what we're going to do next. And they all know about Kaiser. And for the first time, I wasn't saying the name. I was just saying a large HMO group. However, one lady goes, can I just tell you, let me guess, it starts with K. I hear it all the time. That's unacceptable. And I think that if you go in there for ordinary care to be shuffled in and out, you're going to be fine. You're not going to have problems. And I think there are a lot of people that don't have problems. But when you're really ill is when you'll really see the problems, because you have to have the hospital stays. In the first room, I told them that I don't know if they're calling it an allergy to the pill Norco. I had taken it when I had wisdom teeth pulled. I was vomiting horribly from it. The dentist advised that I try some more food and try to keep taking it, and then I would get used to it. However, when I did that, I started wanting this pill, which is not like me. I'm not an addictive person, so I called him. I said, I can't take that pill. I'm really worried about it, so I discontinued it. And I told them that because they were going to put me on Norco. And I assumed that it would be put in my notes at that point because they gave me Percocet instead. Dilaudid. When I got to the next room and that woman, they finally decided to start me on pill form to get me prepped to leave. And I was woken up to her, and she said, here is your Norco. And I said, but I already told them that I was vomiting from it. She goes, you don't want to try it? I said, no. She goes, I can't physically handle vomiting right now. And she goes, so you're refusing it? I said, well, yes, I can't tolerate it. And I had a lady next to me as well who heard the whole thing. And she says, what do you want? I was a little taken aback because I've never had a doctor ask me what I want to prescribe. And I said, well, I don't really know pain medicine. I know I'm on Dilaudid, and the bigger dose made me really loopy, and I would rather have less. And she goes, well, how about Percocet? I go, well, if it's similar, that's fine. And then she asked me how many pills I wanted, 1 or 2. And I thought to myself after the fact, if I could tell you what brands I wanted and how many I wanted, I probably shouldn't be getting this medication from you. It was just, I felt like I was being my own doctor. The other thing that was really bothersome to me is I knew it wasn't just me. The lady next to me had a hip replacement, and it was infected. And she was agonizing in pain. She had a really hard time because, you're right next to them. And each night they would have her fast for surgery the next morning, and then you'd watch the doctors come in and say, you know what, we're so sorry, the OR filled up and we can't do your surgery again. I watched this for 3, I think she had the night before, 3 nights in a row that they did it to her. When I was discharged, it was December 31st, and they had told her they promised the OR would have room for her on the 1st. This woman sat in agony for 3 days just because they didn't have a bed for her, and they made her go through the prepping each night, which was very worrisome because she was trying to prep for this major surgery. And they were just too busy to get to her surgery. when I discussed this with member services, they said they should have moved her to another hospital rather than putting her through that. You know, so I'm hoping for her sake she got that surgery on the 1st, because I was discharged and I don't know. But it wasn't just me. She also had a beautiful vase. Someone brought her flowers. She knocked it off trying to get her TV stand. A huge crash. My husband was there, and you know, a huge breaking from a height, and you're in the hospital. A Kaiser employee was walking down. My husband thought it might have been a janitor, so he finally popped his head in, and he says, and my husband goes, "Well, it was a vase, and it's glasses all over." And no one ever came to see us. We assumed he would come back with someone to clean up the glass, because glass is dangerous. For all they knew, one of the patients had fallen. I mean, they didn't know the source of why this glass had broken. No one ever came. I finally called in a nurse for my stuff, and that said, you know, her vase broke all over. There's glass throughout the place. Could you please, you know, clean it up? And that's when they tended to her. But I thought, that's very scary, because if it was one of us had fallen over and we couldn't get to a call button, what would have happened then? And we were the nurse's station was right behind our wall. We were the last door.
So the failure you feel to give proper care in your case, and other people apparently that have similar problems, has led to a terrible situation now.
It has, because during my core biopsy is when this, it definitely, you can see the toll, because I got a hold of bits and pieces of my medical record, and I was contacted by the genetics department and told that I was adopted, which I'm not adopted. This was news to me, and that was my final straw when I called member services. I said, how many mistakes is it okay to make on one person? This is utterly ridiculous. I now have to take anxiety medications to go into your service because they keep messing up. I was told that I got a hold of a piece of my records, and it listed that I was, my father committed suicide at the age of 49 and was an alcoholic. And I really have no clue as to where that even came came from, because I just recently found my biological father. Son's going to come in here. And he was alive and well. So, and I've never discussed suicides at all. So I couldn't believe that. And then I went to one doctor. I have a new lump forming from the cancer, which 3 weeks after I felt this lump after my surgery and asked about it, and I was told it was scar tissue. And I had pain prescriptions prescribed because of the pain from it. It's now cancer as well. It's spreading through my whole body. And he wanted to cut it out immediately, and he felt it was more likely scar tissue than anything else. And so I was hesitant because he didn't want to do any testing. He just wanted to cut into it. Now, after my experience with their surgery, I was very hesitant to go under the knife with them again. But it didn't seem right to me to have no testing, none. I said, well, can't we have an ultrasound? He said, no, we can see that it's a lump, so an ultrasound won't tell us anything. And I said, well, can we have, what about a biopsy? And that's just going off of what I had done previously. And he said, well, biopsy has a 10% chance of false negative. And I respect that. However, having a test, if it came back cancerous, gives me a definite, positive. And if it came back negative, then at that point I would need to consider the 10% possibility it was an error. And
wait 1 minute. You want to go through? Yeah. Okay, that's okay.
You can cut it. And so he refused. He said he was going to cut in. Only way he could be positive is cut into it. He was also very concerned of why I didn't go to my original surgeon, but I wasn't told I had to. So at that point, they gave me a refund because he offered to give me the refund, because I said, it's not fair to me to come in here if you thought I should have been with the other doctor, daycare and everything else. So they did give me the refund, and I broke down because when I go too much into my story, it's very hard for me. So I do have a good oncologist willing to, she can't go out of the standard of care, and she wasn't working with the chemo changes that I asked for. However, she has been willing to give me a lot of testing, and she ordered a PET scan, a CT, an MRI, lots of them. And in the PET scan, we now know that this is in fact cancer, and they do not recommend me having it cut into at this point. So he would have cut into it, even though if a scan would have told him that they don't recommend it, which is scary to me. I mean, how do you make so many errors in one person's records? It's error after error. And I've only been there 3.5 years.
And you have your children. You want to be with your family. I mean, this is a horrible situation.
The worst part for me is when they called and told me I have cancer. You know you have cancer, and you can't change that fact. But sitting there in the core biopsy, I went through the mammogram. No, this is my clogged duct. This is my clogged duct. And in the core biopsy, she looked at me and she asked. She says, "No, that's not. Who told you that?" And I gave the doctor's name at that point. And she goes, "Oh, this is part of this." And I had to digest that. And I went out for the first time. I was crying in the hall because I realized at that point I'd been on birth control, because the first thing they did was pull me off the birth control. You can't have it. I had a lump with breast cancer for like 1.5 years, being fueled by the very thing that spreads it. And I found out after my surgery, and I was being explained what they removed and about it, that the first lump was called in situ, and it doesn't travel outside the body, which means I would have probably had a lumpectomy, no spreading, curable. Now I have it full throughout my body, and I don't know how long I have with my 3 children, and it could have been prevented. There was no reason for it. They didn't have to, one simple test would have told them what it was, and they gave me not one test. And on top, and even with the birth control and the history, and I try to understand where mistakes can happen, but I'm a red flag. I've already had cancer, so I'm the last patient that you don't send to a test. They kept saying your age, you're 36. It's probably not this. You're 9 times out of 10, and it's almost scary when there's these concepts out there, because so many women I meet are my age, and I can't tell you how many of them are getting diagnosed while pregnant. It's amazing. I mean, I thought when I was trying to digest, I was this unique, huge case, and I'm not. What I have learned from this experience, when you're trying to understand cancer, before this, I was just a budgeting mom, on a tight budget and trying to make our dollars stretch and be there for our kids. And so the word organic to me was taboo. I can't afford organic. I don't understand. There's got to be nothing to it. And when I've researched it now, I'm shocked at what they get away with. The GMO, genetically modified food, is being pumped into our society, and there's no testing, none. And you see the average obesity rate raising constantly. I mean, it's all around us, and no one questions it. So I started looking into stuff like that, and it's amazing to me. I have gone all organic, and it's taken months, but I no longer have allergies that I had horrible allergies before. My mom's lost all of her allergies and all of her ailments since, she's cut it out. But to know that there's no testing done on these chemicals and that you're not allowed to not use them. Farmers, I guess, are being brought into court and sued if they don't use this genetically modified corn. I had no clue. I mean, it was just shocking to me. And I'm putting this into my small children. The milk has hormones and antibiotics. And, I never thought like this. I told my husband, I feel like I'm turning into a Berkeley hippie. But when you have cancer, you have to start figuring out what went wrong. I may not see my little girl grow up, and I may not see my kids grow up. And so you open your eyes and you start looking, and to know you can't even tell me it's safe because you've never tested it, but you're letting me put it in the mouth of my 4-year-old little girl. And when we wonder why these girls are developing faster and faster, and people are bigger and bigger, and we have more ailments, and then we put more drugs in it. And, it's everywhere, but you can't tell me that I just have cancer because of my genetics, because I don't have genetics. And my dogs aren't genetically related to me, but they both died of cancer. And my friends from the city tell me, well, our dog died of cancer too. And this is the animals and the people. They did, my aunt works for, I don't know if I should say where it is, but she works for a company that's in Richmond. And all these women have breast cancer in her area, and it's by a refinery. And there is like a large group, like 10 women in a row got breast cancer. okay, people may an occasional get cancer, but when you have masses like this, why is it that so many younger people daily are getting diagnosed? It's getting younger and younger. And yet we have someone who just turned 90 and no cancers. There are no ailments. She's fine. And all of her siblings are still alive. Yet all the younger ones are dying. We just lost our father-in-law to another cancer. He worked in the construction industry. And I'm sure he was exposed to many. He was also exposed to chemicals in Vietnam, and he had throat cancer, and it's like, why so much? And why is it always these people who have been around this?
Now you're going to be their support for you, and you may be picketing Kaiser.
Yeah.
Why don't you talk about that?
That is, it's a lot to digest, because I'm just an average person, and just a stay-at-home mom. Volunteering in schools was the biggest thing I did, and all of a sudden I have a group of friends that want to pick, because I have sent letters to Kaiser asking to get care outside, and they've denied everything. And 8 pages of a letter. They only looked at the facility that I looked at. They will not address the fear that I'm going through, which when you're going through treatment, you have to have a positive attitude. You do. Your mental state is huge, and you have to trust who's giving them. And I have not done any IVs with them, because I fear that they will cause problems. We know someone who died in the chair recently, and they won't tell them why, that she passed. Or my mother knows that person. So knowing those things, it's like I'm so afraid to have such a toxic treatment administered there with all the mistakes. So I'm down to just pills. That's all. I figure that they can't screw that up. Although for some reason I have some doctor on my prescription bottle I've never heard of. That might be common, so I'll give them that. I mean, things are different, but there's just too many mistakes. So my friends want to gather and let people know what they're doing. They will not acknowledge that it's all in documentation. And I haven't even so much as got a call of sorry, we're sorry that you're going through this. No willingness to help rectify what happened.
But they could allow you to go someplace else.
Oh, they could. They have, they don't like to, but there are certain circumstances where they do. In fact, they don't, in our area, they're so unprepared for emergencies that they don't even have a full emergency facility. So if I were to get to a traumatic car accident, for example, I would be sent to John Muir, and they're contracted already with John Muir for that case, because they don't have that kind of hospital in place. So that's something people should know as well, as your facility isn't prepared to even care for you in the event of a traumatic event. And we know someone who went through that.
And
so they could...
Yeah, and in the light of what you've been through, they should allow you to go someplace where you feel comfortable. I mean, this is a life and death issue. You want to feel comfortable. You want to have confidence and optimism that you can recover or fight this. That's what you were asking. Yeah.
So and not to be sitting there making decisions, not because you don't want to take the medication, but because you don't trust the person to administer it. I'm on a Herceptin is a typical IV injection for my because I have a rare form aggressive. I'm triple positive, so it's highly aggressive, and they know this. And I'm on Tykerb because it's a pill. They want to do a bone test, something for my bones, because it's eating away at my bones, the cancer now, and I can barely move. But it's only IV, and I'm afraid to do that. So I'm doing a supplementation instead. What amazed me is in one of their denials, I got 3 letters postmarked the same exact day, one telling me I had until the 18th to give them further information. And on the same day, I got a letter saying that the meeting had already taken place and I was denied. And I thought, well, how do I give you, today's the 12th, you've posted on the 11th, and how do I give you information if you're prepping the meeting and you write a letter on the same day stating it's already taken place? And the worst part was the board, the qualified people making this decision, I was not allowed to know any of the names. It said a nurse, a doctor. Now, how do I, as a patient, look at these credentials, which you're allowed to do? You're allowed to look up your doctor's credentials to make sure that educated people in the position to make this decision on my case, were actually present at this board, and that they did in fact have the qualifications. No names were given at all. And I did fax in for the 18th saying, I demand that you address the 8 pages of errors that you've made on my case, and my fear, because the only thing they told me was to seek a second opinion inside Kaiser, even though I explained what happened in the second opinion. because my diagnosis changed from stage 3 to stage 4 since it spread. That was it. That was my first denial. And then I wanted to go to an Invita. I was looking at them because they have a cyber knife that is a more pinpointed form of radiation. They said I don't need that either. But my CT scans weren't even back yet. So how do they really know until they've looked at all of the testing?
So it sounds like, I mean, basically they just want to save money. It's an issue of money, and you know, if you have the money, if you're wealthy enough, then you get what you want, and otherwise they're going to basically stall and prevent you from getting what you need.
And that is definitely what I feel. And with the law of malpractice from 1974, you're entitled to a malpractice suit of $250. It's never changed. So the scary part is that's cheap. I'm cheaper to be dead than I am to live for them. So what is motivating them to give me care? Because if I live 20 years with all these major treatments, it's going to cost a lot more than $250. And they also have a binding arbitration, and Kaiser members should know that you don't get a jury. And these people are in there day in and day out with all these malpractice, and it's all silenced. That's part of the contract. And that's not okay. Why are they treated differently than every other doctor in the state or the country?
So what you're saying is these HMOs like Kaiser are by law being allowed to get away with not really giving fair treatment to people because of the procedure they've set up.
And they don't have to answer for it. They don't. I mean, they get to go into a binding arbitration. No one gets to hear their story. No jury, nothing. It's silenced. But if I was at another place, that doctor has to stand up and has to be tried by his peers so that the patient gets a fair trial. And you don't get that with Kaiser. And the other doctors have to have that responsibility where Kaiser gets away with it. And when you're in a system with arbitration constantly, they know who the arbitrators are because they work with them constantly. When you have a jury, you don't know who you're going to get. And so it becomes unfair because they have a upper hand by being in the system all the time.